Assalamu alaikum dear doctors. In this video I am discussing a video station. So first we will watch the pictures, the image what it is showing. So look the first image, that is showing air bruising from being boxed. And the second image in the middle, this picture is showing loop marks inflicted by a cord. And the third picture is showing bruises of different ages inflicted at different times. Now I am telling the video stations that you describe this video. So I am seeing on the ear bruising from being boxed, and there is on the showed the loop marks inflicted by a cord, and the last one is showing bruises of different ages inflicted at different times. Now in this patient, what history you would like to ask? So the history I would like to ask: number 1, full history of the events; number 2, any previous similar conditions; number 3, nutritional and growth history, as failure to thrive can occur due to child neglect; number 4, family history of bleeding disorder; and number 5, detailed social history, particularly for a caregiver. I am again repeating the history I would like to ask in these stations. Number 1, full history of the events; number 2, any previous similar conditions; number 3, nutritional and growth history, as failure to thrive can occur due to child neglect; number 4, family history of bleeding disorder; and number 5, detailed social history, particularly for a caregiver. Next question: what is your most likely diagnosis? So my most likely diagnosis on top is non-accidental injury. What is your differential diagnosis? The differential diagnosis of this station is bleeding disorder as hemophilia or wound liver disease, VWD. Next question: in which presentation you have to consider a child abuse? So the answer is that delay in seeking medical attention following injury. These are including number 1, history incompatible with injury scene; number 2, numerous explanations suggested for injury; number 3, changes in the history; number 4, parents shopping around for medical help. Example from GP, acute and emergency, different hospitals. And then history of domestic violence, and odd or aggressive parental behavior, or any fracture in an infant without a satisfactory explanations, any bruise on a child age less than 6 months or pre-mobile, pattern of bruising, injury or explanation not compatible with child's development, recurrent injuries, evidence of other forms of abuse like failure to thrive and neglect, previous evidence of injury or neglect, check if child known to local authority, children's social care, or is the subject of a child protection plan. So these are the point presentation you have to consider child abuse. Next questions: what investigation you want to request in this patient? So in investigation, note this is investigation for patient who suspected child abuse in general. So initial we do the baseline investigations. These are full blood count and blood film, APTT and PT, not INR, thrombin time, fibrinogen levels, if thrombocytopenic mean platelet volume, von Willebrand factor, antigen and activity, that is ristocetin, cofactor, recof. Factor 8 and 9 assay if male, blood group. Skeletal survey will do if it for children age less than 2 years with unexplained injuries. Repeat views after 11 to 14 days are required. I am again repeating. Suppose this is a child abuse history, what investigation you would like to do? I would like to do the initial baseline investigations. These are full blood count and film, APTT and PT, not INR, thrombin time, fibrinogen levels, if thrombocytopenic mean platelet volume, von Willebrand factor, antigen and activity, ristocetin, cofactor or recof, factor 8 and 9 assay if male and blood group. Skeletal survey will do it for children age less than 2 years with unexplained injuries. Repeat views after 11 to 14 days are required. Next question: which other specific injury suggests trigger of a skeletal survey? So when we do the skeletal survey, serious injury due to suspected non-accidental injury, these are any fracture, burn more than 5% total body surface area, traumatic brain injury, intra-abdominal or intrathoracic injury, and injuries requiring PICU admissions. And other investigation we do head CT scan in children age less than 12 months, and in older children if focal encephalopathic features, focal neurology or hemorrhagic retinopathy. Bone biochemistry including vitamin D, parathyroid hormone if there are unexplained fractures. Subsequent investigations if significant bruises. Before further investigations, discuss with pediatric hematologist. Von Willebrand factor, antigen and activity, factor 8-9 if not already done, factor 13 assay, child age less than 2 years, platelet function assay. Now, how can we manage this patient? Suppose this is a child child abuse. So first I would like to admit this child. Always discuss referrals with the on-call consultant for child protection duties, SBAR. So first we are on-call consultation for child protection duties. Immediate action: if there is an urgent or life-threatening situation, start necessary emergency treatment. Refer to a trust on call child protection arrangements. If you suspect harm, refer to social care and police if they are not already involved. Keep any social worker or police officer involved and informed. Always consider potential risk to siblings or other children. So again repeating the management portion of this child abuse, non-accidental injury. I would like to admit this patient. Always discuss referrals with the on-call consultant for child protection duties. SBAR. Immediate action including if there is an urgent or life-threatening situation, start necessary emergency treatment. Refer to a trust on-call child protection arrangements. If you suspect harm, refer to social care and police if they are not already involved. Keep any social worker or police officer involved and informed. Always consider potential risk to siblings or other children. So this is all about this video stations of child injury, child abuse or non-accidental injury, you can say. Please do subscribe and share. MRCPCH with Dr. Emma Chaudhary. Thank you.